Hello. Thank you for joining us for the December 4th media availability. We're here with Deputy Health Officer Dr. Josh Ennis, and Dr. Ennis is going to introduce us to someone who we've all been wanting to meet, Dr. Ian P. Hoffman, who's expected to be named the county's new health officer pending confirmation by the Humboldt County Board of Supervisors on Tuesday. Dr. Hoffman replaces Dr. Teresa Frankovich, who saw the county through the first 10 months of the pandemic and stepped back from the role earlier this week. Dr. Ennis.
Great, thank you. So as you know, pending confirmation, we have a new team member to bring on board today. And given Dr. Frankovich's announcement earlier this week, we thought today would be a good opportunity, given that it's going to come before the board next Tuesday, to not only introduce you to Dr. Hoffman, but also have him maybe discuss the current state of affairs as well as the recent stay-at-home order. So without any further delay, I'd like to introduce Dr. Hoffman.
Thank you, Dr. Ennis. And thank you, Humboldt County. I'm honored to be offered this position on such a wonderful team. I've had the opportunity to work with this team for the last month, and you are truly blessed to have this amazing team at Public Health, in the JIC and the EOC, helping in this effort for COVID. They've been at this for 10 months, working tirelessly, and the work they've done is amazing. I am coming back to Humboldt County. Been coming here off and on for the last 15 years. My wife's family has been here for a long time, and we're excited to be here with our family again and make this commitment to Humboldt. I'm a family doc by training and have an MPH, Master in Public Health, from Rutgers, as well as my medical degree. Most of the last 10 plus years I've been working in Spanish-speaking communities, working closely with my partners in those communities, and I'm excited to continue that work as the Public Health Officer of Humboldt County. So a little bit about me, but a lot of people want to know about this new stay-at-home order from Governor Newsom and the team that came out yesterday. A little context. We are in a statewide surge, as most of you probably know, with rates going up across the state, and obviously within our own county, the numbers keep going up every day. We're really just seeing right now Halloween coming into fruition from gatherings and parties that happened around late October and early November. And that's concerning because we have yet to see the effects of gatherings from Thanksgiving that will probably come in another 2 to 4 weeks. The big concern here is that we've seen an 86% increase in hospitalization statewide in the past 14 days, and a 67% increase in ICU admissions for COVID in the last 14 days. So that's really the reason that such urgency has been placed on these measures. There's an 8 times increase in the death rate over the last month in the state of California. So what do these measures mean? We're going to be looked at as a region with our Northern California partners, and the critical measure are the number of ICU beds available to our population in Northern California as this region as a whole. If we dip below 15% of our ICU capacity, it will trigger these new stay-at-home orders. So they don't start yet, but they will start if we meet that critical trigger. There are some predictions from the state about when this will happen, and we are being told based on their projections that it could be as early as the next week. So we all need to prepare. The state's going to be looking at these numbers daily, and when we hit that trigger, we will have 24 hours to put these changes into effect. So what do these changes look like? So some of them are similar to what we're already under in our purple tier status, but there are some changes, so I'm going to highlight those changes. Temporary closure during this time period of bars, wineries, personal services, hair salons, barbershops. Schools will remain open. So schools that are currently open do not have to close. Retail shops will remain open as well. at 20% capacity, and we are encouraging monitoring and metering of that capacity in and out of retail facilities. Restaurants can stay open, takeout and delivery only though. Outdoor recreation does remain open, so getting outside, going on hikes, bike rides, going to the beach. We want to encourage people to stay active and healthy throughout this time. Campgrounds, however, will be closed. There was also a statewide ban on travel, except for essential travel. And essential travel is something that will also be allowed for lodging purposes. So hotels and lodging can provide lodging for essential travelers, but not for anyone else. So those are the main takeaway points, and we will be updating continuously throughout this, as we always have, as we get more information and have more data to share with our community. Thank you.
Thank you, Dr. Hoffman, and welcome to the team. Thank you. All right, so we'll move on to the questions from local media. The North Coast Journal asks, local officials have explained previously that local hospitals staff ICUs based on the patient census, which can impact the available bed data on the state database. How does this impact the state's ICU capacity metric that will determine which regions are placed under a new stay-at-home order?
I think providing a little history here about the number that's being looked at is helpful before we talk about the actual answer here. And the California Hospital Association has a bed poll that hospitals fill out daily. Throughout the entirety of the pandemic, we've been following some of these numbers that have been reported out, and it has changed 8 times since April in terms of what numbers they ask for and how they define those numbers. So this has been somewhat of a moving target. I can tell you that more recently they've changed the definition that available bed means they're capable of staffing it, even if they don't have a nurse standing by to accept the patient. And so the number is much more steady more recently. I can tell you that within our county, the state is looking at a number that may not accurately reflect our true healthcare capacity to care for the sick. And so stay tuned, we'll be giving more details in regards to this in the coming days.
I'd also like to add that our ability to staff these beds can be greatly impacted by what's going on around us too. Counties around us with higher rates of hospitalization, higher rates of COVID, higher rates of ICU will take away from our ability to staff these beds, and that's why we've taken this regional approach and why the state put that forward. And not only regionally in California, but in the rest of the country, the surrounding states are seeing bigger surges than us, and it can be very difficult for us to get these beds staffed properly if we were to have more of a hospital surge. So we have to look at all this in the context of things that are going on, not just here in Humboldt County, but in our region, in Northern California, in California as a whole, and in the whole country, because all these resources are scarce right now, and they're affecting our ability to take care of COVID.
Yeah, thank you.
The North Coast Journal asks, has the county begun to see any cases related to Thanksgiving gatherings?
Yes, the answer is yes. We have seen many cases, and we expect to see many more.
The North Coast Journal asks, for weeks now, local and state officials have been issuing urgent pleas with people to stop gathering with people outside their households and to stop traveling. Have you begun to see any decrease in the number of new cases locally related to gatherings or travel?
I think we just answered that. No, if we're expecting to see an increase in continued cases related to gatherings from Thanksgiving, and we hope that some of these measures that we're putting into place right now are going to, hopefully in a few weeks, we would start to maybe see those numbers come down from those measures.
Thank you. The North Coast Journal asks, regarding the case cluster at Granada Rehabilitation and Wellness, have all residents in the facility now been tested, and are any of the results still outstanding? And can you tell us when the staff member was tested, when they were notified of their positive result, and whether they'd worked in the facility between having their sample taken and receiving their test results?
So this merits a little discussion regarding the regular screening testing that's occurring within the facility, as well as the response testing. So the state mandates weekly screening testing of the entire staff within these facilities. Once you have a positive, you enter response testing and you test the entire facility. And so we have been doing that over the past week. And you generally test once a week until there's no cases for 14 days. So I can tell you that this has all been picked up within the past week. Without giving too many details to reveal a particular identity of any individual, I can say that given the rapid increase in number of cases, we suspect that there may have been some introduction undetected earlier than us picking it up this week.
Thank you. KMUD News asks, the county dashboard is a useful tool for tracking day-to-day case increases by geographical area, but the timeline graphs do not include a breakdown of case increases by region. When will more regional information be made available so that people can see how many cases have occurred in each area of Humboldt over time?
I'd just like to remind folks where this information comes from. The zip code data comes from CalReady. We pull it from there, and the zip code data can change on a day-to-day basis as we do our case investigations. Right now, we have on the order of a couple hundred case investigations ongoing, still under investigation to determine how they were actually acquired. So it is a fluid number that we provide. It can go up, it can go down. And so it should not be used to assess risk in any one particular location. I think I know what this question is getting at, that people want to be able to know what's going on in their community, but it really shouldn't be used that way because this provides the address of record. It says nothing about where the exposure occurred, and in reality, it's across the entire region. We have several lines of transmission. In fact, it's more than several. It truly is on the order of tens of lines of transmission, and it spans all corners of the county at this point. So that data should not be used that way.
KMUD News asks, can you confirm which public spaces and businesses in southern Humboldt have had employees contract COVID-19 recently, and how many individuals are currently known to be fighting the infection in Soham?
So we don't really track it that way. There's no public reporting of individual businesses. If there is determined to be an exposure in a business, that it will be notified by our contact tracers and investigators team to let them know, that when that exposure happened. So businesses are aware if that has happened in their business. And I'd say if you want to see how many people in a certain region have been COVID positive, you can go to the website, look on the dashboard, like Josh just mentioned. But we really want to stress the fact that we're at a different point in this pandemic than Humboldt has been to date. This is now spreading in our community. It's not a traveler who came in and we do our investigation and we can stop the spread. This is now spreading easily in our community, and there is no data out there that's going to tell you where you can go to avoid COVID in our community. You can avoid COVID by not gathering, wearing a mask, and distancing from anyone who's not in your household. And those are the messages we put out from the beginning, and it's now more important than ever.
Thank you. The Red-Headed Black Belt asks, how many ICU beds are currently occupied in the county, including non-COVID ICU patients between all 4 hospitals? And how many total ICU beds does the county report are available to the state in total?
This information is available through our county dashboard. There's a link right at the top redirecting you to the state's website. You can click on hospitals and then you can select Humboldt County. I can tell you that as of 2 days ago, there were 18 patients in total, COVID and non-COVID alike, sitting in an ICU bed across the county. And in terms of how many total ICU beds reporting to the state, as I said early on, this has been changing throughout the course of the pandemic. It has been redefined as we've seen how the numbers maybe don't reflect what's really happening on the ground. And we're probably going to be talking about this, what number they're actually looking at in the coming days as we get a better sense of what it looks like across the region.
The Red-Headed Black Belt asks, what is the routine testing done at Granada scheduled to occur weekly or monthly, or was this the result of a newly implemented routine testing schedule?
So I think I already spoke to this. There's once weekly testing for the entire staff, and once a positive is found, there is essentially once weekly testing for the entire facility. They have been doing this for quite some time. They're working really hard, and they have done everything that has been asked of them to keep their residents safe. And unfortunately, this disease is quite tricky, and it slipped by the screening processes. And we know that that can happen. And this kind of gets to the point of what we've been saying all along. We want to protect the healthcare system, and we do that by protecting the vulnerable. And when disease is this widespread, it becomes very difficult to do both those things, protect the vulnerable as well as the healthcare system. And, you know, I think many of these residents have family members in Humboldt County. Many of them have grown up in Humboldt County. So this is a time to think hard about what we're doing and what our actions say about what we think of our community. So let's care for one another, and it's real now. So let's really try and work hard to keep everyone in this county getting the care that they deserve.
The Red-Headed Black Belt asks, of the 30 people who tested positive at Granada Rehabilitation and Wellness Center, how many approximately are symptomatic? Are any experiencing serious symptoms?
So this kind of builds upon the last question. We're not going to release information about any particular individual. I can tell you that there are a significant portion who are symptomatic, and we know that many of them, just given their age, are going to be at risk for severe illness. If there is any significant change as related to healthcare capacity or information that's important for the public to know because it has potential impact upon public services, we will release that information if and when it occurs.
The Red-Headed Black Belt asks, can the health officer please clarify if businesses such as accounting firms, law firms, and notary services qualify as critical infrastructure and therefore may remain open for business currently, and if Humboldt is given further restrictions by the governor?
Yes. The answer is yes. These are critical infrastructure, and they can remain open under the current tier and also with the new stay-at-home orders that are potentially going to be activated as soon as this week. You can find out more about critical infrastructure and who is critical infrastructure at humboldtgov.org. There's a listing there by sector, what is critical infrastructure. If you still have questions, you can always call the JIC at 707-441-5000. Thank you.
Thank you. The Las Coast Outpost asks, was the recent outbreak at Granada brought in by an employee? If so, is it known how that employee might have acquired the virus, close contact, travel, etc.? To your knowledge, did management at the facility follow all appropriate safety measures in this case, or were there any known lapses?
I've already spoken to this, but I think it's worth saying again. Granada has been working hand in hand with us throughout the entirety of the pandemic. They are doing everything that we have asked of them, and they have been a true partner in this. I don't know that we can ever say exactly how the virus was introduced into this facility. I can tell you that given how quickly the numbers have increased in a very short period of time, there's strong reason to believe that it was introduced prior to the first person we picked up on routine testing. And this just goes to speak to the fact that right now is the time to, even when the person sitting across from you is well and healthy, to still take the same routine precautions. Avoid gatherings. Do not go indoors with people who are outside your household. Wear a mask and practice good hand hygiene.
The Time Standard asks, what's the most recent information you have on when the Northern California region outlined in Governor Newsom's latest directive will fall below the 15% threshold of available ICU beds?
So, like I mentioned earlier, we've been given projections that it could be within the week. we will definitely update folks if we hear anything sooner. They're going to be looking daily at the numbers for the region and update us. And when they do pull the trigger, that we'll have 24 hours to put that into place. So look out for that news over the next few days to week.
The Time Standard asks, hospitals in Humboldt County have a total of 27 ICU beds. California's dashboard of COVID hospitalizations shows 11 Humboldt County patients, 3 of whom are in ICU beds here. When do you expect Humboldt County's ICUs to hit capacity?
I would just like to point out that there is no shortage of information on the internet right now, and I haven't had a chance to review where these numbers are being pulled from, what the source data is. I can tell you that these numbers are incorrect, and so I would encourage you to, again, go to our county dashboard. At the top, there's the state website. You can go to the hospitals, and they have a Tableau page where you can scroll through the counties, including our own. As far as when we expect Humboldt County's ICUs to hit capacity, given how our population is small enough that our ICU numbers are quite small, and they can be dramatically impacted by a swing of a few patients. Patients move into the ICU from the hospital, they move into the ICU from the ER, they get discharged from the hospital, straight from the ICU even sometimes. So this is a very dynamic number. Again, given how small they are, too, when there is something such as a skilled nursing facility outbreak where we know there's a lot of people at risk for severe disease, that creates potential for a big influx in the hospital in a very short period of time. So it is very difficult to predict at what point we'll be at capacity. I'd like to reassure everyone that everyone is getting the care that they deserve right now, but there is cause for concern about where this trajectory could take us, because we're starting to see hospital numbers today that are a result of transmission that began upticking 4 weeks ago around the time of Halloween. Now, if you add Thanksgiving on top of that, as well as ongoing cases within a skilled nursing facility, what the hospital system looks like in 2, 3, 4 weeks from now could be very, very different. And so this just hits home that 90-car locomotive has gained a significant speed, and we need to act now to slow it before we're out of options.
The Time Standard asks, will any Humboldt County beds be filled by patients from regions whose hospitals are already overwhelmed?
So I don't control what the hospitals do. I'll just say that up front. But we have been in honest and frank discussions with our hospital leadership across the entire county. I think we all understand that given how small the numbers and our current case numbers across the county, as well as what is ongoing in a skilled nursing facility, does have a lot of potential to impact our ability to care for the sick. Given that being the case, we have agreed as a county that it probably doesn't make sense to accept transfers from distant, faraway places such as Southern California, for example. There are a lot of logistical issues with caring for that patient, getting them back home, the transition back home, and whatnot. Now, if a neighboring county has a dire need, I can't predict all scenarios, but in general, we are doing our best to make sure we can care for our own and not compromise that by filling beds with people from very distant locations.
The Time Standard asks, can you comment on the amount of hospital staff it takes to care for a COVID patient in and out of an ICU?
Yeah, and so this gets to the healthcare worker bottleneck that we've talked a lot about. A patient who's in the ICU on a vent is sedated and sometimes to a level where they're not moving a whole lot. At times they may even be paralyzed. And so they require a lot of bedside care. And that's a lot of nursing care. A respiratory therapist may be there to work on ventilator issues. They have oftentimes indwelling lines and catheters that need a lot of work. And so you need a lot of people to care for ICU level patients. the COVID patients who have yet to go to ICU, who maybe are on oxygen, still require a significant level of care. They may need assistance turning over for proning. You've probably heard about those position movements that can help open up the lungs. Every time a person goes in and out of these rooms, they put on PPE, they take off PPE. It's very time intensive and requires a lot of people. And to make this really concrete, we can talk a little bit about nursing in Humboldt County. And we just need to take a step back and talk about what's happening across the state as well as across the country. We all know that we're in the third wave right now, and it's bigger than any prior one. Nursing is a in-demand profession throughout the entire country. And when there have been unmanageable surges of hospital patients, nurses have gone to help fight the cause, right? And that makes sense. It's a very honorable thing to do. Other healthcare providers have done the same. And so if we find ourselves in the midst locally of a dramatic surge, nurses that maybe would normally be here on a rotating basis may not be available here. And so it makes us more vulnerable to this healthcare workforce shortage. And it's a very fine line for us when we have the smaller population, the smaller ICU capacity, and receiving hospitals being very far away, faced with similar situations.
And I just add to that, Josh, that all what you're saying really highlights the complexity of this and how there's no, number that we can give people or, dashboard. I mean, it's a very complicated situation, and we're watching it very closely. We're in contact with the hospitals, we're in contact with the state on an ongoing basis to make sure that we know where we're at. So.
The Time Standard asks, what treatments are people getting once they're admitted?
So this is something that hasn't changed over the past several months. If they're an appropriate candidate and they consent to it, they are offered and receive remdesivir, steroids, and convalescent plasma.
The Time Standard asks, is the county making any special efforts to communicate the risks of COVID to residents 20 to 29 years of age, who were in data most recently reported by the county, the largest cohort in the age distribution of its positive cases?
The answer to this is yes. We are, I think not just locally in Humboldt County, but everywhere, public health is trying to message to this group of young folks that it's important that we take these things seriously because it's one of the main drivers of this. And as Josh said earlier, our actions as young people affect things that happen down the line, like hospital admissions and ICU admissions for our most vulnerable population. And, it's really hitting home right now with Grenada having this outbreak. And I think, we're all very cautious about where this might go. So please, yes, follow the guidance we've been asking for so long. Check your social media, see what you need to be doing, staying at home. And you can always look for updates on the Humboldt Health Alert as well.
Reporter Daniel Mintz asks, the last 2 days have had record numbers of new case confirmations. What proportion of these are related to specific events or settings, such as long-term care centers, and what proportion represents community transmission?
We're seeing record numbers. Again, this really stems back to Halloween and late part of October, early part of November. We've yet to see the outcome of Thanksgiving. While the numbers we've seen at Grenada are large, they're certainly not nearly as large as the other numbers we've been seeing daily coming out for the last several weeks, predating even Thanksgiving. We were very concerned about the daily numbers that had gone from as little as 5 a day in October to 10 plus a day by the beginning of November, and then by the time we were heading into Thanksgiving, we were seeing 20, and now we're seeing 40. And so our concern is high that these numbers will still continue to go up. We are hopeful that the community and these measures will get together and we will start to see a plateauing and maybe going down over the next weeks into Christmas time, hopefully.
Reporter Daniel Mintz asks, we've had various levels of restrictions during the pandemic. How well do you think they have worked in controlling disease spread?
We know that the things we've been saying all along work. There is far more of a body of evidence supporting these things now. The key issue here is how much we choose to enact them and how much we choose to adhere to them. So these level of restrictions, or framed another way, level of operating safely, are things that we know slows down the disease, and if we're choosing to ignore them or not enact them, then they're clearly not going to be effective. So that's what I'd say to that question.
And I would add there's been a lot of evidence to support the use of these measures, not just here in California, across the whole country, and globally. These measures have been proven time and time again, so this is why we're doing them.
The Redwood News asks, does public health have an idea of how many vaccines Humboldt County is set to receive in the first phase of vaccine distribution?
We have an idea. So we know that there are 330,000 doses statewide given to California. We will get a proportionate share of those for Humboldt County. We, can't give definitive numbers right now because we don't have them in our hands, but we are excited to be getting this first shipment. It could be in the next few weeks. So we are rapidly preparing for that and how it will be distributed.
The Redwood News asks, can you give a real-life description of what the new travel restrictions announced by Governor Newsom yesterday under the regional stay-at-home order means for Humboldt County residents?
Sure. So, as I mentioned in the beginning, this is an essential, a travel ban except for essential travel. So essential travel is defined by things, if you're working in a critical infrastructure and you need to travel for that work, then you are allowed to travel. Clearly, obviously, a concrete example is a traveling nurse, like we've already mentioned. There are many nurses who might need to come travel here to help us if we see a surge in our hospital census. There's a lot of critical infrastructure. I mean, the list is very long. You can go check it out where I mentioned earlier and see. So those are clear examples. I would say, outside of that, there are very few examples of essential travel. There can be personal reasons for families, experiencing end-of-life care, a death in the family, those sorts of things. But we definitely want to be aware that this is not a travel to go escape an area that has a higher rate of COVID. That is not essential travel, and it's not because we had a planned vacation that we wanted to go on, and it's not to go visit family members in another place in our state or county or somewhere else in the United States. So those are some real-world examples that I would give that I think really highlight what the essential travel is about.
The Redwood News asks, we heard that a patient was transported from Fort Bragg to a hospital in Eureka the other day. If hospitals in other parts of the state are reaching capacity, how likely is it for patients to be transported up here to Humboldt? And how would that impact our local hospital capacity, especially in regards to how it would impact their ability to care for patients if there was a surge locally in COVID-19 hospitalizations?
So as I already mentioned, the decision to accept or not accept a patient is entirely up to the receiving hospital. There are patients who flow between hospitals all the time for non-COVID related issues. This happens all the time in a pre-pandemic world. We have come together as a healthcare community with the hospital leadership as well as public health to talk about our current status of healthcare capacity, our current case numbers, and that includes what is ongoing within one of our skilled nursing facilities. And so the hospitals are very aware of the situation, and we have gone so far as to look specifically at making projections for hospitalizations, for example, assuming there were so many people within a nursing facility affected or who were picked up as positive. So we are all in discussion. We've been preparing for this for some time. They are actively working on making sure they can meet the demand.
Reporter Matt Lefevre asks, I was wondering if you could tell me whether Humboldt County would be receiving any vaccines in the coming weeks as the first round are distributed throughout the state. If so, how many?
Yes. So again, the answer is yes. We will be getting vaccine. We've been told we're getting vaccine. We think it'll happen again in the next few weeks if things go as planned. The number is not publicly available right now, but I'd say, when we know better, we can discuss that more, and we are putting that plan in place to get that vaccine out as quickly as possible once we have it in our hands. We have partnerships with local hospitals to store the vaccine. We're working on the distribution plan with many partners in the community, in healthcare, emergency medical services, all the sectors that are going to get it in the first round. And I'll just say, this is, it's very exciting to be at this point, finally in the pandemic, where there is real hope for the end of this. I think all of us, and this team has been working so hard on it for so long, it feels like we are approaching the finish line in the vaccine. We're very hopeful that we'll get it out over the coming months into the spring, and we will keep everyone updated as those priorities come out and as the numbers come out, how much we will be getting as we get them. Thank you.
Thank you both for your time, and again, Dr. Hoffman, welcome to the team.
Thank you.
Thank you.